Reye syndrome primarily affects children ages 4 through 12 but can occur at any age. It is not genetic, and it occurs when children who are recovering from a viral infection, such as the flu or chickenpox, take aspirin, and this results in the mitochondria in the liver cells getting damaged. It can also cause swelling of the brain. The symptoms occur in 4 stages. Stage 1, vomiting, loss of energy, and drowsiness. Stage 2, aggressive behavior and irritability. Stage 3, confusion, combative, and irrational behavior. And stage 4, delirium and even a coma. Some symptoms you might find in infants with Reye syndrome would be diarrhea and respiratory problems, as well as any of the above symptoms. There are many common ways to diagnose Reye syndrome. The most common would be blood tests, MRIs, liver biopsies or liver tests, and then spinal taps to check the fluid around the spine. The life expectancy for this is pretty simple. If it's not treated, it's just a few days, and if it is treated, most of the patients will survive, but they risk permanent brain damage. There's no sort of shot or pill you can take in order to prevent Reye syndrome. Your only option is just to not take aspirin. But during the treatment process, you need to stay in the hospital. And in the hospital, they'll give you lots of fluids. They might provide you with a cooling blanket to help maintain your internal body temperature. And then a diuretic to decrease intracranial pressure and increase fluid loss. And then any sort of medication that you need. In 1963, Dr. Douglas Reye, along with fellow physicians, published the first study of the syndrome. Reports of the syndrome date back all the way to 1929, where people had similar symptoms. So in 1964, Dr. George Johnson published an investigation of an outbreak of influenza B, where 16 children developed neurological problems, and 4 of them had similar symptoms to that of Reye syndrome. In 1979, Dr. Karen Starko and colleagues conducted a case control study in Arizona where they found the first statistically significant link between the use of aspirin and the symptoms that you would get from Reye syndrome. The case number has also gone down, so in 1980 there were about 555 reports, and now from 1994 to currently there's only about 2 cases reported per year. So there's a very good website to learn more about this syndrome. It's called the National Reye Syndrome, and there's a ton of information on the symptoms, treatment options, etc., as well as many links. There's a really good one about the link with aspirin. And then there's a medical library, as well as a place where you can put in a case report for Reye syndrome.